The suicide rate in the United States has continued to rise over the past 20 years in spite of significant efforts to raise awareness and reduce the obstacles to seeking help. Researchers say part of the problem may be that the core assumptions about the best ways to prevent suicide may be flawed, and they are working to find better ways to identify people before a crisis.
It is one of the leading causes of death in the U.S. According to provisional data, more people died from suicide last year than any other year on record.
One of the key aspects of preventing suicide is being able to identify individuals who are most vulnerable to attempting suicide.
That's why Craig Bryan and his colleagues at the Ohio State College of Medicine and Wesleyan University started studying how patients were screened at primary care clinics. The researchers believe traditional screening for suicidal thoughts would be most effective at identifying which patients were most likely to attempt suicide, but that wasn't what they found.
The key finding was that the most effective way to identify patients who would eventually attempt suicide was to screen them for depression.
The team found screening for depression correctly identified more patients who would go on to attempt suicide than traditional suicide screening.
Primary care healthcare providers should really be focusing on identifying patients who have depression, and then that might serve as a gateway for determining who might need additional treatment and intervention to prevent suicide.
Yeah, sometimes getting the right answers means asking the right questions. Some doctors also said the screening forms can actually get in the way of actually talking to patients and getting a feel for how they're truly doing. Experts say treating depression and addressing other life stressors like financial pressure, also very important factors in suicide prevention. Remember, you can get help 24 hours a day, 7 days a week if you need it by calling or texting the National Suicide Prevention Line at 988.